So hi everyone, myself Anusha P, Assistant Professor, School of Physiotherapy, SBV Chennai. So today we are going to see about balance and balance training. What is balance? Balance is nothing but maintaining an equilibrium posture within the center of mass and the base of support. The center of mass is nothing but the center point of each body segment combined, and the center of gravity is a vertical projection of the center of mass. The base of support. Base of support is the area of the object that is in a contact with the ground. For a human, the base of support is the width between the two foot which is in contact with the ground. Larger the base of support, greater would be the balance and the stability. Narrow the base of support, the subject might lose the balance. Balance center of mass over the base of support. Then this is a vicious cycle. When a subject tend to fall, they go for a muscular imbalances or some pain if they get injured. So it causes an inactiveness of one muscle and it leads to the imbalance. Then this imbalance leads to the fall. So this vicious cycle, if you break one chain, the other can be managed. Indications or needs for the balance and balance training. Gait and balance difficulties are regardless of the underlying neurological or orthopedic conditions. The common neurological conditions are Parkinson's, multiple sclerosis, stroke, diabetic neuropathies, head injuries, etc. And the vestibular disorders that causes the dizziness. The orthopedic conditions are osteoarthritis of lower limbs, and the osteoporosis, sarcopenia. An elderly benefit from a specific balance training is to prevent the risk of falls and fractures. The precautions are, before training for the balance, first we must check for the fall risk score and any comorbidities like diabetes mellitus or the hypertension or any cardiovascular things. So the recent surgeries and the injuries. Now we are going to see about the type of balance. The type of balance is steady state balance, reactive balance and the proactive balance. In the steady state balance, we have two like static steady state balance and the steady state dynamic balance. The static steady state balance is nothing but the balance maintained in a steady state. The reactive balance is like a reaction to some perturbations in the space. Like when we are traveling in a bus, a sudden break or something reacting to the situations. Then in a proactive balance, when we are the proactive balance, it is on the anticipatory balance. It is on the past experiences. The brain organizes the things and act accordingly. Then the steady state balance, maintaining a stable position in standing or sitting. This happens when the center of gravity is on the axis of rotation. Reactive balance, recovering from an unexpected perturbation. That is, the reactive balance is defined as an automatic movement patterns or strategies that occurs when the balance is disturbed. There are faster responses than movements under the voluntary control. If the response is appropriate, no loss of balance will occur. Then the proactive balance. Proactive balance, to develop a device which provides a safe, controlled, simple and inexpensive reactive balance training for the adults. The anticipatory or the proactive balance occurs. Body recognizes that something is going to happen. Then it processes in the cerebellum and basal ganglia and it maintains the balance. These are the systems of balance. The system of balance is, in center we have a stability. First, the brain thinks and acts accordingly, the task oriented, whether we have to step back or step in or move sidewards. So the task oriented, it central sets and it organizes the things according to the environmental needs, and it coordinates with the motor system from the motor cortex to the spinal cord. Then the spinal cord sends impulses to the musculoskeletal systems. Accordingly, the balance is maintained. So the stability and balance is nothing but the result of interaction of many variables. Those are the somatosensory components and the vestibular somatosensory components, sensory components and the motor components. So the result of interaction of many variables, the limits of stability. Distance in any direction, a subject can lean away from the midline without altering the base of support. For example, if we are about to take an object without moving from the support, without moving from the ground, picking an object from the ground with the minimal perturbations. Determinants of firm base of support. In the firm stable platform, we can take an object without any movement or any risk in the fall, or if we tend to do the same activities without any training on a wobble board or any other platforms or in a moving platform, we may tend to fall, or we may have a fear of fall. So the strategies of balance are nothing but ankle strategy, hip strategy, stepping strategy and the suspensory strategies. These are the automatic strategies and occur 80 to 90 milliseconds after the perception of the instability is realized. The ankle strategy. It is used when a perturbation, that is perturbation is nothing but the change or push or pull activity. Perturbation is slow and is of a low amplitude. The contact surface is firm. Just an ankle make a modification to maintain the balance without moving from the base of support. The muscles recruited are from distal to proximal and the head movements in phase with the hips. So in the ankle strategy, when it is a forward sway, it happens from the paraspinal muscles, abductors, hamstring group, quadriceps, gastrocnemius and the tibialis posterior. In the backward sway, it happens paraspinal muscles with the adductors in the lower grade and the quadriceps in the adductors and the quadriceps works together along with the tibialis anterior. Next is the hip strategy, used when the perturbations are fast and large amplitude. Surface is unstable or shorter than the field. The muscle recruited are from the proximal to distal, head movement out of the face with the hips. In the hips energy, when the sway is forward, the abdominal muscles are recruited first, then followed by the quadriceps group, then the tibialis anterior. In the backward sway, it causes the recruitment of the paraspinal muscles, hamstring muscles, followed by the gastrocnemius. Then comes the stepping strategy, used to prevent a fall, used when the perturbations are too fast and larger amplitude, or when the strategies fails, the hip and the ankle strategies fails, the stepping strategy occurs. That is the surface contact moves from the base of support. Then the suspension strategy. Suspension strategy is nothing but a forward bending of the trunk with the hip and knee in flexion. That is when a sudden perturbation or when a sudden changes in the balance occurs, the person might tend to lean forward to maintain the balance without falling down. Next is the model components of sensory organization. Earlier we saw the motor organization, that is the musculoskeletal organization. Now we are going to see the sensory organization. The sensory organizations are nothing but the somatosensory, visual and the vestibular. The somatosensory are nothing but the joint receptors and the mechanoreceptors present in the joints and the neck muscles. Then comes the muscle spindle, muscle length, Golgi tendon organs and cutaneous receptors. What happens in the somatosensory? Usually in case of maintaining a balance or in a balance activity, first comes rather than the joint receptors, the muscle spindles and the Golgi tendon organs work in a faster manner. The work of joint receptor is just to stimulate the Golgi tendon organs and the muscle spindle. Earlier, the recruitment of the muscle group causes the activation of the muscles and for maintaining the balance. Next is the visual system. Visual system is caused by the eyes. The eyes, the gaze and the visual tracts senses the changes in the environment and it sends the impulses to the motor cortex through the vestibulo-ocular and the optic systems. Then it maintains the head in position with the neck along with the mechanoreceptors. Then comes the vestibular system. In vestibular system, we have a semicircular canals and the otolith organs. The semicircular canals works for the angular perturbation or is the angular velocity changes, whereas the otolith organs works for the linear changes in the balance. Then comes the vestibular system assesses the head on the trunk, and it sends the impulse, and the mechanocepta sends the impulses to the vestibular system for maintaining the position of the head. Next comes the sensory motor integration. First, what happens, the somatosensory before the vestibular and visual senses the changes in the balance. First, the somatosensory senses the things, and it sends the information to the higher centers. From the higher centers, it sends the impulses to the basal ganglia and cerebellum for the processing. Then it sends the impulses to the spinal cord. Spinal cord sends the impulses to the postural muscles for maintaining the balance. Thank you.